Rahim. This study named Association of Morning Blood Pressure Surge with Carotid Intima-media thickness and carotid dysfunction in patients with cardiac syndrome. Published in 2018 in Blood Pressure Journal. Firstly, cardiac syndrome X is characterized by typical angina chest pain, objective evidence of ischemia associated with normal coronary angiography. The pathophysiology of cardiac syndrome X is multifactorial. Coronary microvascular dysfunction was suggested to be underlying pathophysiologic mechanism. Moreover, endothelial dysfunction and precapillary arteriolar shear stress have been implicated as important contributing factors. It was suggested that morning blood pressure surge is a good risk parameter for increased prevalence of cardiovascular events occurring in the morning. The association between morning blood pressure surge with carotid intima-media thickness and carotid function in patients with cardiac syndrome X was not clearly studied. This study was designed to investigate the relationship between morning blood pressure surge with carotid intima-media thickness and carotid function in patients with syndrome X. Our patient should be met the diagnosis of cardiac syndrome X based on the presence of typical exercise-induced angina pectoris associated with transient ischemic T-segment depression more than or equal 1 millimeter during the treadmill exercise, and consequent normal or nearly normal coronary angiography. Significant exclusion criteria include significant arrhythmia, sick sinus syndrome, left bundle branch block, valvular heart disease and mitral valve prolapse, myocardial infarction, unstable angina, cardiomyopathy, congestive heart failure, pulmonary disease, stroke, and other neurological disorder, musculoskeletal or collagen vascular disease. The control group 70 subject present with chest pain and had a negative exercise electrocardiogram and normal coronary angiogram were recruited and serve as a control group. Data collection, all patients were subjected to complete history taking, general and local examination, resting ECG, ambulatory blood monitoring, echocardiography, and carotid ultrasonography. Ambulatory blood pressure is done in 24 hours and calculated automatic every 20 minutes. Morning surge. Sleep blood pressure was defined as the average of blood pressure reading from the time when the patient went to bed until the time he or she got out of bed. Awake blood pressure was defined as average of blood pressure reading in all the day. Morning surge in blood pressure defined as mean of blood pressure during the first 2 hours after walking minus the mean blood pressure during the night. The result demographic characteristic of patient with cardiac syndrome X compared with control group, showing significant increase in high sensitivity C-reactive protein and carotid intima-media thickness in carotid syndrome X than control group. Also, in blood pressure variable in our patients, showing increase in the morning surge in the cardiac syndrome X and increase in systolic blood pressure. رجعنا تاني قسمنا الجروبز بتاعتنا إلى 2 groups: exaggerated morning blood surge and versus patient with normal morning blood surge, group 1 and group 2. Showing significant increase in the heart rate and high sensitivity C-reactive protein in group 1, which is exaggerated of the morning blood pressure surge. Also, increase in blood pressure, left ventricular filling pressure, E/E prime ratio, carotid intima-media thickness, and plaque number in exaggerated morning blood surge group. By multivariate analysis of predictor variable for increased carotid intima-media thickness, showing the morning blood pressure surge is highly significant to detect the carotid intima-media thickness and E/E prime in subject with cardiac syndrome X. This figure showing the highly carotid intima-media thickness significant increase in patients with exaggerated morning blood surge than others group. Correlation showing the blood surge is increased with carotid intima-media thickness, high sensitivity C-reactive protein, left atrial volume index, and E over A prime ratio, and show the more significant difference in the carotid intimal thickness and C-reactive protein high sensitivity، وده بيفسر لي الانفلاماتوري بروسيس اللي بتحصل في السندروم X. The conclusion, we found a significant association between an exaggerated morning blood pressure surge and increased carotid intima-media thickness, diastolic dysfunction, and increased left atrial volume index in patients with cardiac syndrome X. Likewise, homocysteine C-reactive protein, high sensitivity C-reactive protein was correlated with both morning blood pressure surge and carotid intima-media thickness. These findings suggest that cardiac syndrome X could be explained in part by morning blood pressure surge and or hypertensive vascular change. So morning blood pressure surge may serve as a useful clinic marker of cardiac syndrome X. Thank you.